Good afternoon, everyone. Today I'm going to be discussing research that evaluates a rare disorder called hereditary spastic paraplegia. So, how many people in this room have someone they really care about? I think it's safe to say that we all do. Well, what if someone close to you got diagnosed with HSP? How would this affect their everyday lives? This is something we're going to dive into. Until about 2 years ago, I had never heard of the term hereditary spastic paraplegia. I was introduced to this disorder when someone very close to me got diagnosed with it. This disorder is very rare, affecting only 1 in 100,000 people. When the cute little boy pictured above got diagnosed with this disorder, it drastically affected his life, and I got to see firsthand how it did so. In the top picture, you can see how he's able to bend his knees and sit in my lap. This picture was before he got diagnosed with HSP and before any manifestations were visible. The bottom picture was taken this summer. I was having to hold him up due to his balance issue, and you can see how both of his legs are stiffened as he's not able to bend them much anymore. He went from being a healthy 6-year-old to barely being able to keep his balance. This disorder also affected his cognitive abilities by slowing his speech and making him forget how to count and his ABCs. Since there's no cure for this disorder yet, I thought it would be very beneficial, not only to myself but to others as well, to get educated on HSP and figure out ways to manage it. My research question is, in what ways does hereditary spastic paraplegia affect the body and cognitive abilities? When I formulated this research topic, I was focusing more on nursing interventions and management for this disorder. Only one of my research articles used a theoretical framework. The theoretical framework it used was called an integrated approach. An integrated approach evaluates each person as a whole and tailors specifically to their individual needs. They take in all the aspects of someone's life and produce a plan that fits their personality. In the study that I found, each participant provided 1-week real-time descriptions of daily activities and associated experiences. As a result of this study, it showed the importance of tailoring rehab programs on individuals' perceived challenges and abilities in order to promote their activity engagement and tasks representing opportunities for both skill improvement and socialization. Among the articles I found, 5 were quantitative studies and 1 was a qualitative study. The quantitative studies included 2 descriptive cross-sectional designs, 1 quasi-experimental design, a case control study, and a cohort study. There were many different methodologies used for the quantitative designs, including an experience sampling method, a 6-week robotic-aided gait training, self-report data, measurements of bone metabolism, and questionnaires. The qualitative study included a single qualitative design. During the qualitative study, there was an observation done of a male's case who had complicated HSP. To show their different focuses, I divided the results into qualitative versus quantitative. To start off, the quantitative study showed the importance of tailoring rehab programs on individuals' perceived challenges and abilities. They also showed how balance, walking ability, and quality of life improved when patients went through a 6-week robotic-aided gait training, and how these improvements were maintained over a 2-month follow-up period. In another quantitative study, it was shown that people with HSP frequently lived alone and reported lower life satisfaction, mental well-being, and social support. They also report poor memory and sleep, musculoskeletal pain, constipation, and urinary incontinence. It was also found that most patients with neurological diseases can develop osteopenia or osteoporosis. Lastly, through the quantitative studies, it was shown that the greatest burden was experienced from muscle stiffness, limited standing, and walking activities. These all can cause a burden due to leg pain and back pain, the use of walking aids, high risk for falls, and the injuries that can result from falls. Moving on to qualitative studies, I found that the need for target genetic testing SPG11 mutations was recommended during these studies. This mutation can cause spastic, paraparesis, mental retardation, and amyotrophy. Moving on to the limitations. So a common limitation given by the authors was the small sample sizes that were used. Given that there were small sample sizes, the study cannot be representative of the entire HSP population. This prevents result generalization. Another limitation present is self-selection bias in attrition, due to the long sampling sessions that occurred and the onerous task of randomly filling in questionnaires during daily activities. It is also a limitation that there is a lack of literature on hereditary spastic paraplegia and that there were no control groups in some of the studies. One of the studies I found was based on self-reported diagnosis and not genetic confirmation, so this is also a limitation because the person may not have really had HSP. During the same study, they only used lower body effect as a proxy for pure HSP when it's likely that some people in the control group experience neuromotor problems as well. Some other limitations include being biased to select more mobile patients, not measuring inflammatory markers, using only questionnaires, and a lack of physical exams. Next, I'm going to discuss recommendations that I came across as I did my study. First, I'm going to dive into the author's recommendations, and then I'll go on to things that I recommend. As you can see, there are many different recommendations given by the authors. First, people with hereditary spastic paraplegia should be supported in finding more challenging opportunities for action in daily life in order to attain engaging and optimal exercises. Also, that their exercise and motor functions should be promoted through physiotherapy programs and physical activity practice. Job placement should also be favored, as the productive activities can foster engaging experiences as well as personal growth and social inclusion. Social interaction can be facilitated through engagement in family and community activities. Another recommendation is that rehab programs should focus on improving patients' independence in ADLs and the individual's perception of well-being. They also suggested that the future studies should examine longitudinal development of the problem areas for patients with HSP to provide better standards of care. Other recommendations included that osteoporosis and bone health should be considered in all patients with inflammatory and degenerative chronic neurological diseases, and that family screening and genetic counseling were advised. I also wanted to throw in some personal recommendations I thought of throughout my research process. First, I would like to see more extensive research be done on hereditary spastic paraplegia. As stated in one of the limitations, there is a lack of literature on this topic. Secondly, more studies need to be done in the United States. Majority of the studies I found were done in other countries. I also think that when studies are done, they should have larger sample sizes and the use of control groups. If larger sample sizes are used, the results that are found could be representative of the HSP population as a whole and therefore be generalized. Control groups could be helpful during experimental studies, so the groups being tested have a group they can be compared to see how a treatment or therapy is affecting the subjects. It would also be beneficial to evaluate the long-term benefits of certain therapy options to see how they affect HSP patients in the long run. Lastly, I think it would be very beneficial if nurses, caregivers, and family members made sure to provide an adequate amount of physical and emotional support to those who have HSP. This population needs assistance in their everyday lives, and they need the adequate amount of support to carry out their ADLs. From my study on hereditary spastic paraplegia, I have learned that physiotherapy and rehabilitation programs are very beneficial to people who are diagnosed with this disorder. Therapy and rehab should be individualized for each patient and tailored for their specific needs. These types of programs have been studied and can improve their quality of life. I have also learned that it is important to monitor for bone metabolism in patients with HSP because this type of disease can lead to osteopenia or osteoporosis. It is also important to educate not only patients who are diagnosed with HSP, but also their families on genetic testing and counseling services. Overall, I have learned the many ways that hereditary spastic paraplegia can affect the body. This disease causes stiffening of the muscles, poor memory and sleep patterns, lower back pain and leg pain, slowing of cognitive abilities, many GI and GU problems, and a high risk for falls and injuries. One of my favorite outcomes from this study is the progress they are making with this rare disease. A couple of years ago, my family and I struggled to find any information on this disease, and although there could be more sufficient research by now, a little is better than nothing. In the future, as a nurse, I can implement what I have learned by educating people on HSP and warning signs that manifestations of this disease are occurring. I will do my best to continue educating myself on this disease and hope that one day they find a cure for it. Here I provided a list of my references. If you would like to follow up with more research, please feel free to look at my references as a source to get you started.